Good afternoon. My name is Laura Gonzalez, and I will be presenting my research project utilizing simulation to improve critical thinking skills. This project is part of the Teachership Academy Phase 2. I would like to first introduce the importance of critical thinking in post-secondary school. Critical thinking is considered a goal. Therefore, our students seeking a degree in college are required to take general courses that have critical thinking embedded. It is assumed that at the end of this phase of education, the students have mastered critical thinking. However, when they are enrolled in the nursing program, it's been noticed that the students still show a degree of deficit in using this important aspect. Critical thinking in nursing education is an essential component and is also one of the learning outcomes of the program. Therefore, instructors in nursing are responsible for introducing the students at a very young age to this concept, which we will carry throughout the curriculum. Why is that critical thinking is so important in nursing? It is considered to be one of the skills, among others, that will help in shaping the student to become a proficient nurse that is capable of providing the patient with safe and effective patient care. The problem that was identified is that the students in the common concept of adult health course have difficulty applying critical thinking in theory and also in the clinical area. And the purpose of the study is to find or determine if the student has the ability to incorporate theory into clinical practice and also to explore their perceptions in developing clinical judgment through simulation. From the problem that we addressed before, I came up with two questions. Can simulation enhance clinical judgment and clinical reasoning of students in the second semester of nursing school? And number two, can simulation help students apply concepts learned in the classroom? The concept of simulation is not new to nursing. It's been used as a teaching strategy since the first nurse tried to teach the first nursing student how to perform or how to task properly. Over time, simulation has evolved from the use of static mannequins and role-playing to a more sophisticated mannequin that resembles a real patient with vital functions. The use of simulation is supported by the National League for Nursing. They address the fact that it is an effective teaching method. And the National Council of State Boards of Nursing address that up to 50% of the clinical experiences can be substituted with simulation and still obtain the same positive outcomes compared to the students that will attend a regular clinical rotation in any given clinical area. Studies also support the use of simulation in fostering critical thinking. So we have a wealth of resources that demonstrate that simulation in reality works in helping our students improve their critical thinking skills. But one might ask, what is critical thinking when it refers to nursing? Well, if we were to review literature, we will find that terms such as clinical judgment, problem solving, or even decision making are documented, but all refer to critical thinking. Tanner describes a research-based model for clinical judgment, thinking like a nurse. The model has applications for nurses, but is also suitable for teaching purposes. In her model, she describes 4 phases, and each phase interrelates and starts with noticing, and it finishes with reflecting. Each one of them form a loop that gives feedback to the next one and give context of a patient situation and the care that is provided. I will start by briefly describing noticing, and this is when the nurse enters in contact with the patient. She begins by observing, and in other words, noticing data that could be subjective or objective. Then she collects that data, associates the data, and analyzes. This will help the nurse to put together signs and symptoms of any given patient condition. For example, in the presence of a patient that shows dry lips and skin that has consumed few proteins and is bedridden, the nurse will right away identify that there's a problem that will need to be addressed and corrected. During interpretation, the nurse begins to reason in relation to the data that was noticed and assessed, and concludes that the patient is malnourished, is dehydrated, and that has problems with mobility. Therefore, your patient is at risk for a bed sore. The next stage is responding. In this stage, the nurse, after collecting all this data, decides whether she needs to intervene or not. In the case of this particular patient, the nurse will understand that interventions will need to be implemented to correct the problem. Therefore, she will turn the patient frequently in bed, will feed the patient with high protein value meals, and will hydrate the patient. During reflection, the nurse assesses the interventions and whether they were effective or not. At this point in time, the nurse will make adjustments also in their interventions based on the patient's response. In the particular case that I've been describing, I would say that, for example, if a patient did not consume enough protein, then the nurse will look for alternative ways or interventions to solve that aspect of the problem. At the very end, if the plan was effective, the nurse will notice that no bed sores were developed by the patient. During simulation, reflecting is very important, and I would like to enhance this portion of the critical thinking or clinical judgment portion of the diagram presented, because this is where the students obtain most of their experience. They sit, they reflect, they analyze what went wrong, what went right, and what they learned. And from there, we can see that the students obtain an individual growth in the clinical area, and also it helps them obtain more of the critical thinking skills that we're looking for to improve. The research design that I used was an experimental study using two classes, one for the fall of 2014 and the next for spring 2015. It was a sample of students in the common concepts of adult health. The control group was the second semester students during the fall 2014. Both of the groups received the same lecture. Fall 2014 class was not required to review prior to the session, but the class of 2015 was required to review just prior to the scheduled session. At the very end, the participants completed a 5-point Likert scale and results were obtained. On this table, on the left, we can see the items that were analyzed during the survey, and on the center portion, we see the scores for the fall 14 and the spring 15. And on the very right hand, we see the difference. Overall, we can see that the class of 2015 outperformed the class of fall 2014. The only area that I see where a very modest amount was reflected is in the area of problem solving. What I think might have happened is that students felt inaccurate at times because mistakes happen, and they felt inaccurate in providing patient care. Otherwise, we see improvement. At the very end, the students verbalize that they enjoyed the session, that they actually appreciated how the instructors provided feedback, and they also liked the fact that they were provided with a situation that was realistic. So actually we were able to provide them with a clinical experience that was pretty close to a real one. In summary, findings reinforce the fact that simulation is a great tool in helping students improve their critical thinking skills and in applying concepts learned in the classroom. The students reviewing the lecture content prior to simulation consistently outperformed those who did not. I have just a cartoon there that talks a little bit about clinical judgment, and it's about a student that gave something, I believe it's Tylenol, through an IV instead of an NG. And at the very end, she's saying, well, that's what you told me. And she says, don't worry that I gave the Tylenol IV. I flushed it as you said that I needed to do. So it tells us that the young nurse or the student is very young in their critical thinking, therefore very prone to make mistakes. I thank you for your time, and that's the end of my presentation.